Howdy, my name is Feli Basic, and today I'll be covering resilience in children after trauma. This is mainly after prolonged exposure to domestic violence. This can vary between physical and mental abuse from caregiver or the caregiver's intimate partner. My topic is on what predicts resilience in school performance for children who have experienced domestic violence. I chose this topic because I am interested in discovering how domestic violence affects a child's social and emotional competence, and then how this in turn affects their school performance. While some children struggle with academic setbacks, there are a significant number who are able to rise above the adversity and excel academically. So, how does domestic violence affect school performance? Well, children who are exposed to domestic violence are 3.7 times more likely to develop internalizing and or externalizing behavior problems. According to studies, girls show higher levels of anxiety while boys show higher levels of aggression when compared to children who are not exposed to domestic violence. Abused children also show lower social competence and higher risk of developing problems in academic performance. Domestic violence impacts a child's adjustment in school and their ability to learn and form friendships. However, studies also show that 54% of domestically abused children are able to positively adapt and are characterized by easy temperament compared to their non-resilient counterparts. These children were found to have non-depressed mothers who were able to provide effective coping mechanisms to their children. So, what is resilience? Resilience is the ability to adapt and function successfully in high-risk environments or following exposure to prolonged trauma. What are the factors that predict resilience in children? A positive parent-child attachment has been shown to buffer against the negative impacts of domestic violence. By providing emotional and mental support following exposure to violence at home. Researchers have found that caregivers, mothers in particular, who suffer from fewer depressive and traumatic symptoms, have a greater capacity to maintain a secure attachment to their child, are able to physically and emotionally be available, which offers a vast amount of emotional support. These caregivers tend to also derive support from the community and close friends, which aids in maintaining a positive mental health, which in turn gives them the ability to push through the adversity and adapt better parenting strategies. Teachers in the community are also able to provide ample support and resources to aid not only the child but also their caregivers. Teachers who are able to recognize the signs of domestic violence are able to direct the child to someone who can help stop the violence as well as direct the child to counseling. The community also establishes a safety net to ensure the child is protected from the abuser and so that they can start working towards bringing their lives back to normal. Some theories that I learned in this class that I think can be tied to these topics are John Bowlby's attachment theories and Baumrinn's parenting styles. As I mentioned before, parent-child attachment is significant in developing resilience in children. Securely attached children are able to show better social adjustment and better social skills. This helps them adjust in school and allows them to interact with their peers appropriately, which in turn aids in increasing academic performance. According to Zena and Coley's, child-parent psychotherapy has been shown to be effective in helping children who have been exposed to trauma recover. A study also found that parenting characterized by warmth, responsiveness, and appropriate discipline has the potential to facilitate the development of strength and emotion regulation and pro-social skills. In conclusion, Resilient children gain support from their maternal caregivers who show resilience themselves. These children are able to maintain high motivation performance and are less likely to drop out of school and are likely to pursue long-term goals. So, a question to you is, how do you define resilience? Do you know someone who grew up with an abusive caregiver? And what happened to him/her to get through that adversity? This concludes my presentation.